Hello everyone. Thanks for joining us for the second discussion on a topic that is devastating our region, the opioid crisis. I'm Harrisburg Police Commissioner Thomas Carter, and today we will be focused on the human toll of this epidemic and speak to people who have been directly affected by this crisis. I have with me on the panel today Gina Reardon. Gina, can you please tell us a little bit about yourself?
Yes, I am the program supervisor for Drug-Free Workplace PA and Family Education. And more importantly, I'm a mother of 5 and a son that currently is in recovery.
Okay, thank you for that,
Thank you.
Gina. We next have Kathy Strain. Kathy, can you introduce yourself and tell us about yourself?
Sure. My name is Kathy Strain. I'm the education consultant with Drug-Free Workplace PA and Family Education. And I'm also a parent who has children in recovery and unfortunately lost one of my sons on August 31st of this year to an opioid overdose.
Thank you for that, Kathy. We next have Dan Albert. Dan, can you introduce yourself and tell us a little bit about yourself, sir?
My name's Dan Albert. I have an organization called Hero in the Fight. I'm a person in long-term recovery, which means I haven't touched a drink or a drug since April 30th, 2017.
Very good. And last but not least, we have Officer Cynthia Kreiser. Officer Kreiser, can you tell us a little bit about yourself?
Yes, my name is Cynthia Kreiser. I'm a police officer for Harrisburg Police Bureau. I've been employed for 5 years as a patrol officer. I'm assigned to District 4, which is in the Allison Hill area.
Okay, thank you for that, Officer Kreiser. Welcome to everybody here. To remind our viewers, we are calling this issue a crisis because people are dying in record numbers from overdosing on painkillers and on dangerous drugs such as heroin. And the people who are dying come from every class, every race, and every socioeconomic group. Our first show focused on explaining the nature of the problem and how communities around the nation are overwhelmed by the crisis. This show will focus on the impact the opioid crisis is having on our friends and neighbors. Okay, let's get started here. I would like to ask Gina, can you tell us in your own words your experience working with families, including your own, to combat the opioid addiction?
Well, our family journey began about probably about 4 years ago, and our son, we knew at the time, was dabbling in alcohol and marijuana. And we got a phone call, and he was being rushed from the high school to Pinnacle ER, and they had detected at the high school that he was not acting normal. They were very concerned about him, and so they rushed him into the ER. And so that was really our wake-up call from a family perspective. And so I won't go into a lot of detail, with his journey because we don't have a lot of time tonight. But, it was for me, having 5 children and him really being the only one going down that path was just an eye-opener for me in that I really, as a parent, need to step up and I really need to educate myself. And so I got very involved at the local level from an education perspective, started working with the school district, got involved at the state level on a couple of task forces, actually, working with the Department of Drug and Alcohol programs, and then got involved now with Drug-Free Workplace PA and Family Education. And what we work really hard is working with communities so they have a better understanding of what is addiction, really trying to destigmatize the whole topic and for them to understand how to come alongside of their loved one and to help them.
Thank you. Thank you, Gina. Kathy, you have experienced something that families all over the state are experiencing right now. Can you please tell us a little bit about your situation that you went through with your family and coping with the addiction?
Sure. My children, I have 4 children, all became involved with using substances in their teenage years. So we've been dealing with this for about 14 years. My oldest will be 30 in November, and my youngest is 23. It was my 27-year-old that did pass away. They started using substances with their friends. An older gentleman, we live in a real rural community, an older gentleman was receiving an enormous amount of oxycodone pills and was distributing them to the high school boys. And it spread like wildfire. My 23-year-old daughter has lost roughly 25 friends to overdose, including her boyfriend, best friend, and brother. So it's been a very difficult journey for us. When my son passed away, I woke up that morning thinking all 4 of my children were in recovery. He was doing well. He was in a sober home. I actually was here in Harrisburg that morning and doing an Opioid Overdose Awareness Day webinar. And it was a few hours later that I received the phone call that he was found in his sober home. For me, for a family journey for 14 years, the best way that I can describe it would be if somebody took a piece of glass and just smashed it all over the floor. And I've spent every day for my life trying to put those pieces of glass back together.
And as you can hear right now, you know that the opioid crisis crosses lines. It knows no boundaries. It doesn't respect color, person, or anything like that. And our heart goes out to you, Kathy.
Thank you.
Dan, can you tell us your journey with this opioid crisis?
Yeah, I'm in recovery from substance use disorder. I've struggled with addiction for over 15 years. I've had 2 rehab experiences. The most recent, I had decided that I had to make an entire change in my life. I had recently, before that, been homeless. I have a daughter that I didn't get to see. She had moved to Philly with her mom, and I had lost a lot of things. My family at the time didn't want anything to do with me, and I decided that it was time to make a difference in my life, or, you know, that was the only option for me. So I work hard every day, work a 12-step program. I have surrounded myself around friends that are taking their lives to the next level, and every day I focus on staying clean just for that day, so that way I can get to the next day. And that's what's been working for me, and that's kind of where I'm at today.
Okay, thank you, Dan. And Officer Kreiser, you've come across quite a few people that are on opioids, and you administer the life-saving drug to bring them back. Can you explain that process to us?
Sure. We get quite a few calls for overdoses. The drug's amazing. It's a very simple way to administer it. I mean, the person could be close to their last breath, and it brings them back. And usually it goes in waves of where we'll go a couple weeks. We don't really have many overdoses, and then we'll go to the next day and we'll have them nonstop if a bad, batch of heroin gets in the city. When a bad batch gets in there, it's just nonstop. All shifts, day shift, evening shift, it's nonstop. I always take 2 kits out, one for them and one for us, just in case we would get exposed to it. Some of the heroin is laced or it's all fentanyl, so if you would touch that powder and inhale it or touch your face and get it in your mouth or whatever, it could have the same effect on you. I mean, if they overdose and then you end up inhaling the powder or whatever, it could do the same thing to you.
Thank you for that, Officer. Mm-hmm. Gina, can you tell us a bit about your program?
Sure. We have 2 tracks. The first track is a workplace track. And so what we try to do first and foremost is to make sure that employers have a policy in place, a drug-free workplace policy in place, and that's very important. And then we also offer on-site and online trainings, supervisory training, employee training, reasonable suspicion. We have a total of 16 trainings, and 11 are workplace and the remaining are family. And one of I would say a couple of the barriers that I have found in working in this capacity is, first of all, just the misunderstanding, I think, of just supervisors not seeing their role in the workplace and how they truly could come alongside of an individual, that is actively using and could get them the assistance that they actually, really need. And then also, too, not really understanding addiction as a whole. We talk a lot about, the moral choice topic, and how, yes, it begins as a moral choice, but at the end of the day, no one that is actually in recovery, will say that that's, what they really had intended, obviously, when they began to use. So we focus a lot, too, on signs and symptoms of reasonable suspicion, and just the whole process overall. And then to the family side, we do a lot of trends, signs and symptoms, but then we also get into really trying to assist families of how to have the conversations with their children. How to have that, and really the conversation needs to start in elementary school now. They need to have an understanding of the risk factors. And if, for instance, if they have, genetic disposition when it comes to addiction, they need to have a full understanding of what that means and openly talk to their children about that. I am blown away by the magnitude of use that is occurring across the state in the middle school and the high school.
Thank you. Kathy, in a recent article put out by the coroners throughout Pennsylvania, it stated how overdose deaths continue to soar in PA. You being an educator now and a counselor, do you see this also?
I do. I also see a huge shift from opioids where we are, from opioids to methamphetamines as well. There's a lot more drug usage going on than just opioids, and that oftentimes seems to get overlooked. There's still plenty of heroin use where I am, don't get me wrong, but I am starting to see a shift in the more rural communities. But it sometimes seems frustrating, as much as we're out there working and trying to get the information out, to see these numbers still rising. For me, I think education is an extremely important component that is missing widely across the state. As far as educating our youth and parents, I didn't understand the risk factors. My children voluntarily made a choice to use a substance. I don't feel that it was a moral choice at all. My children knew not to use substances. They used them when they were teenagers. So they made that decision to do that and became, addicted to the substance. My daughter, she would cry every day that her brothers were going to die. So it really got me when she started using substances. And she was prescribed medication from the dentist, and this was early on. I didn't really understand the full grasp of everything at this point, and she also became addicted. So I think that we're missing a lot of key components, such as education and health care. I think that our civil servants, police officers, nurses, could be doing a much better job in educating public about what's going on and about the different crises. So.
Okay, thank you. Dan, you're sort of a champion, but I understand for you it's a struggle every day not to go back on the opioid, on any drug, period. Mm-hmm. Can you explain to us that feeling and how you deal with that constant battle every day?
I would say maybe not exactly a struggle, but I need to stay vigilant in my recovery process, so that way I keep moving forward instead of looking backward. For me, that includes service work, doing things for other people, helps give me peace and motivation to keep doing what I'm on the path I'm on. With that, I've helped create an organization called Hero in the Fight. What we do is we're a support group. We have a Facebook group page which has 2,500 members and growing. What we do with that is we have events where we raise awareness in the community, we break the stigma of addiction, and we just try to be a source of strength and hope for people that are in recovery, have lost a loved one, have loved ones that are struggling with addiction, to let everyone know it's okay to not be okay, and that if you're going through something, don't be afraid to speak up about it. We spoke at this Halifax High School. Coming up will be an Ephrata High School, and also Mechanicsburg Middle School and High School. And with that, along with kind of what you two do, kind of my vision is, curb the epidemic by stopping someone from going there for the first time. And we want to let the younger generations know that, if you start using, this is the path you could go down. And addiction is all-encompassing. It affects families and lives from, the people that you might not even expect.
So what I'm getting here today is that peer pressure plays a major part in kids deciding to try opioids or not to try opioids. Is that correct,
Yes.
Gina?
Yeah, and I would say also too, the mental health component and like the self-medicating, too, is definitely the journey that my son took. Initially it was peer pressure, but then when he got into junior year of high school, he had depression and anxiety. And we now know with a lot of the research, a lot of individuals that are suffering with substance use disorder also have a mental health component. So he began self-medicating, with marijuana and other drugs to help with his depression and anxiety. So that too.
Okay, thank you. Officer Kreiser, do you believe that police agencies and other government agencies like the county, do you believe that we're doing everything that we can do to combat the opioid crisis?
I think we're headed in the right direction. Just the Good Samaritan immunity law, I think it's in itself I think that is a great thing that they did. I don't know if everyone knows what that is, but basically it encourages people to cooperate with law enforcement, calling in when someone's overdosing, even if it's two people that are overdosing, to call in if their friend's overdosing and not be in fear of being charged. As long as they stay on scene and cooperate and the person that's overdosing goes to the hospital, whether they have drugs on them, they're overdosing, we can't charge them. And I just think that that's definitely a positive. I think on the police side of it, when someone overdoses and they go to the hospital, they get monitored for 3-4 hours and then they get discharged. And I think we need to have a better system for that person at the hospital, just to discharge them. We need to be offering them more of a program to get into or something like that.
I noticed that when you come across some people and you have the unfortunate task of charging them, that you go to the hearings and you let their defense counsel know as long as they agree to go into some drug rehab, then you will forfeit the charges. Can you explain that to us?
Right. If it doesn't fall under the immunity law, especially like with a DUI or something like that, if I end up charging someone, we'll go to the preliminary hearing. You can work with the defense attorney, and if the person agrees to do, usually it's a 90-day program, we'll just hold off on the charges and in 90 days come back and see how they're doing in the program. And the charges at the end of the day for us, it's not really, I would rather see somebody get better. So I try and give that as an option to people that I do arrest. So even though they're being arrested, which obviously isn't a good thing, on the other hand, it might be a good thing because it might get them, the help that they need that they might not have tried to get on their own.
You're under the influence of something, okay?
I'm not under the influence of anything.
There were two males sitting at a church at 15th and Market, and as I drove by, I looked over and he appeared to be acting out of sorts.
204, and he will be going to booking, is that correct?
10-4. Your eyes are like a pin right now. As soon as I approached him, I could tell he was obviously under the influence, most likely on some kind of opioid or something like that. We ran his name, and he was wanted out of parole or probation, I'm not sure which he has to go, but regardless, he would have went down to booking to sit for 6 hours for being under the influence of drugs in public. He was obviously a danger to himself and others.
Dan, what more can be done in your view to assist families coping with the opioid addiction?
I think a lot from my experience is from my own family. They didn't necessarily know much about addiction, and when I went into rehab, they wanted me to come home and live at their house, and it was the same environment that I wasn't flourishing in, but they felt they could keep an eye on me and I'd be safe there. And I had to make the tough decision to move out of that house where I grew up and move on my own and live in a recovery-based environment. That's what led them to kind of be standoffish towards me because of that decision. But I think that if we put more support into education for families and for people that leave rehab facilities, if we can help empower them when they leave the facility into housing, with funding and different programs like that, we can help empower them so that they might not come back again.
Okay, thank you. And I want to thank you all for being so open, so candid in what you're saying and the care. I can feel, that you really care and that you really want to see this here whole thing through. We're going to open it up to the audience right now. Does anybody in the audience have any questions of our panel members?
I'm Jeremy. I'm an addict in long-term recovery. When an addict overdoses, they're just taken to the hospital and they're monitored for 3 to 4 hours, and then they're released, right?
That's correct.
Is there any kind of warm handoff program that, gets an addict aftercare that they need, getting them into treatment, long-term, long-term treatment, something other than just letting them back out onto the streets to continue doing what they're doing?
Well, that's what I was saying. That's something that I think that we, not so much the police, but I think when they get to the hospital, I think that is something that we all need to work on. I had an individual that overdosed, and 3 hours later she was right back in the same area, and I was like, it's just frustrating, that, and I know you have to want help. I understand that, but I think we need to encourage with some kind of a program or some kind of rehab.
I know in Dauphin County, the Dauphin County Drug and Alcohol Office has started the warm handoff. The problem is it's not consistent with every hospital. So I think that's one of the places that we definitely need to focus on, because when you have someone in that situation where they have just overdosed, that's the time that you're going to get them help. And if we're not getting to those people right away in every hospital across the state, we're not going to get these people into help. I lost my daughter March 19th of 2017, and I've learned a lot from the mistakes that I made, not understanding drug addiction and the effects that it has on one's brain. And since that happened, I've started the Elizabeth Lorenzo Eye Care Foundation because parents didn't want to speak out. They were embarrassed. They didn't want to talk about their children having drug addiction. Trust me, I was there. I was one of those people. So I've had to speak out and become educated. And I am absolutely overwhelmed by the amount of people who reach out to us through our Eye Care Facebook page every day who want help. And I'm just very happy that we have help in this county for people who need it. And we are huge proponents for Vivitrol, which is the opioid and alcohol blocker. And I can't talk enough about it. I was on it 8 months for alcohol addiction. It is saving lives, and I just wish that there was a way that we could get more people on it more rapidly.
Anybody else from the audience have any questions?
My name's Kevin. My question's for Mr. Albert. You're a hero in the fight. You say that when people come out of rehab, that a lot of times they're left alone. The bridges with their families might have been burned. They don't have a job, clothes, anything. How exactly can people get in touch with you if you're willing? I mean, you're the bridge between that, right? Explain what exactly your organization does to help people coming out of rehab.
If someone reaches out to Hero in the Fight, they can reach me at dan@herointhefight.org or on our Facebook group page, Hero in the Fight. They can personal message me. My phone number is 717-303-9318. I'll put it out there. Anyone that reaches out to me, I can help facilitate different forms of recovery, whether it be medicated assisted treatment, whether it be recovery housing, whether they want to go back into treatment. I have created relationships and a network with a lot of different organizations that help support individuals. We raise money for recovering housing through the RAISE project. Our goal is to help alleviate a lot of the struggle that comes with coming up with, first 2 weeks rent with a security deposit, and you're coming out of rehab with no job. and you're kind of put out there on your own into an environment out of rehab where you have to figure these things out. And at least we can alleviate the first 2 weeks, give you a chance to get on your feet. That way we can help empower the individual to move on with their lives successfully. I also kind of meet them where they're at. You let me know what you're willing to do, what you're willing to put into your recovery, and I can tell you different forms of recovery options, whether it be support groups, whether it be individuals that are going through the same thing you're going through, kind of networking you with some really good people that really care.
My question is for Gina. How hard is it for you to get into the schools to talk to the kids? We live in Cumberland County, and we have finally got one school that wants to work at getting a program for parents and for kids. So I might be calling you. But we lost our daughter 3 years ago today.
I'm sorry.
To an addiction, and we were not educated. And you can Google all you want, you still don't get it. And if the education I have now compared to then, she would probably still be alive because I know there's more out there.
Sure.
But so how hard is it to get into the schools? What is their hang up with that?
I think it depends on the culture of the district. You know, I will tell you, I feel like more and more school districts are really opening up and asking for training. There's no question. We've also recently been working with a lot of the collegiate groups too. You know, I have found initially working with the administration and just really sharing with them, you know, go in and meeting with them and sharing with them the materials. We are able sometimes to train teachers, you know, perhaps on one of their days off and their training days. But we also work really hard to work with families too and do training within the families. We actually do that for Mechanicsburg District. We offer 4 trainings a year, actually, for that particular community. And they're all centered around our family education that is online. The other component that I didn't mention, and Kathy and I both haven't mentioned, is that we are parent coaches. So drug and alcohol, Pennsylvania Drug and Alcohol Programs last year spent quite a bit of money bringing in the Partnership for Drug-Free Kids, which is out of New York. And they will have an extensive parent coach program. So Kathy and I both are certified parent coaches. And so, you know, we get calls on a regular basis assisting families, really kind of coming alongside of them and first and foremost listening to them, because that was the biggest thing 4 years ago. You know, the stigma was huge, and that was one of the things that bothered me the most is this is absolutely crazy. And we had already lost a young man, you know, to addiction not more than a few months after what had happened with my son. So no one seemed to want to talk about it. So that's when we really I initially started getting engaged with the school district, which they were very, very supportive. And then just really now reaching out, trying to broad-base and do a lot more parent education. But again, you know, we would love to work with you. The most important part that I forgot in the very introduction is all of our services are free. I think I should mention that. We are a state-funded grant by PCCD. And so, you know, we've worked with like Hershey Company, Mack Truck, we've worked with large organizations, but we also have worked with very small employers that may only have 10 employees, to churches. I spoke the last 2 weekends. I've been in, you know, churches and speaking to the congregations there, and then school districts and then universities.
Kathy, what signs should one look for a parent, you know, that don't understand just what their kids are into right now? What signs are out there, you know, that you can, you know, sort of leads, you know, that you can tell that there's something that is going wrong with your child?
I would say attitude changes, behavior changes, anything big, changing friends. You know, kids don't often or always have to change friends. I always try and remember the risk factors, the ABCDs, the age of first use, big life changes, co-occurring mental health disorders, and DNA. As far as risk factors, that's one thing that's important for parents to learn about. As far as using substances, it depends what type of substance. For opioids, when I found out, you know, that my kids had made the switch from pills to heroin, I can tell you I found a lot of bottles of water around, a lot of bottle caps. needles or orange caps from needles when they switch to IV drug use. The cotton torn from cotton balls or Q-tips or cigarette butts, different types of, things like that. But the biggest thing would be changes in their attitude and personal hygiene as well. So.
Kathy and I both are very passionate about properly communicating with your child. And I will say that we had to literally learn how to reparent with our son. We had raised our other 3, and even the younger one, we seem to be doing all right. But with our son, we had to completely learn how to reparent. And so a lot of the communication skills and a lot of the things that we learned through the Partnership for Drug-Free Kids was those exact communication skills. At the end of the day, we want our children to have that comfort level to come to us and say, yeah, I was in that situation, and yes, I tried this, and we don't freak out. We really are very open with the conversation. I think that is the key to so much today, because there is so much out there that kids are being exposed to. And they need to have that comfort level with their family to be able to talk about that.
If you can't see where you walk, just be careful, because if there would be needles and stuff like that. All these orange caps are like the caps to the syringe and the needles. Obviously there's a spoon there where they use to, whether they're, depending how they're using it. Usually there's needles back here. We dispose of needles in the back of our car, just like a little box. So I'll pick them up, and like I said, there's, kids play back here and stuff like that. You don't want them poked with one of those needles. That needle's bent off. Where's that other one at? You just gotta be real careful. That's part of a needle, but there's no needle on it. Usually it's worse than this. Someone will clean it up and then it gets like this all over again, unfortunately. There's a bunch down here. I mean, they're all over, but I try, like when I see them, I try and pick them up and get rid of them. And now with the leaves, it's kind of hard to see, but yeah, it's a lot. Yeah. There's a cap there. I don't see the actual needle, but right down here. So unfortunately, they just use, and sometimes they'll save them for the next time. Other times, I don't know. They just stitch them where they want to.
Hello, my name is Chris. I am a recovering addict. Addiction is a disease that has been around since the beginning of time. I think it is finally coming to the forefront of communities. Mm-hmm. And I don't think it's any one person's responsibility. It's not the police, it's not the doctors, it's all of us.
Yes. Mm-hmm.
And families. My mother raised 2 of us. My brother was a police officer and I was a drug dealer. You can't predict who's going to go down that road. That for me, it's not necessarily genetics or learned behaviors. It was a combination. The one component that I do not hear, I've been participating in a lot of these panels, recently, about, for me, I actually am the public relations chairperson for one of the 12-step fellowships. We are worldwide. There are recovery meetings multiple times every day of the week in every city. I think if people don't know about that, they're missing a huge resource.
I completely agree.
I had to make a lot of changes. But we do recover. My clean date is June 4th, 1989. This does work. I need to do what I need to do. Nobody could have made me do something different until I was ready. This disease definitely changes our brain chemistry. and we become people we don't want to be.
Thank you for that, ma'am. Officer Kreiser, as a police officer, you went through training, the 120 training program. Do you think that it should be more added about the opioid addiction now? Do you think that when you graduated from your 120 training that you were prepared to handle everything that you're seeing right now? How has that changed you?
I mean, in the academy, that really wasn't brought up. Obviously, when Narcan was given to us to use, we had training at the department. Yeah, nothing in the academy about that. But like I said, it's an easy thing to do, and I think what opened up my eyes with the whole thing is once we got the Narcan and seeing how often people were overdosing. My daughters are 26 and 23, went to Lower Dauphin, and I think what opened my eyes to the whole thing is young adults that I remember my kids went to school with, were athletes, good students, are dying.
Yes.
And that, that hits home. Lower Dauphin, you think Hershey, Lower Dauphin, it's everywhere. I think the community, not so much in the city, but people that live in areas like your daughter and your family, they think it's a city problem. A lot of people just think, oh, that's a city. And they're really wrong. And I think a lot of people need to be made more aware of what's going on. I mean, getting into the schools, I think, is a great thing. Just to tell these kids that this isn't the way to go and that there is help out there.
Hey, how are you?
I'm good. How are you?
Good. Are you doing good?
I'm doing good.
Good. How long has it been since
I've been clean?
Since you haven't used any heroin?
It's been 4 months and 3 weeks, and soon to be 5 months.
Very good. So
yeah.
Good.
And it's so much better because now I could actually go shopping. I could actually feed myself. I gained 21 pounds.
Very good. Yeah, you look. I can tell.
Can you?
Yeah, absolutely. You're not so. Your face is fuller and you look good.
What advice would you have for other people who are going through that?
Yeah, what made you take the step to actually
do it for yourself and not for others? Because everyone would give me advice to do it for my kids, do it for my mother. She's elderly. You can't do it for others if you can't do it for yourself, because
Okay.
Yeah.
That's pretty much what. And before you get in trouble, because I never been in trouble with the law until I got in that crap.
Right.
And I lost a lot of friends for that, and I don't want to be one of them either, so.
Right. Well, I'm glad you're doing good and keep doing whatever's keeping you away from it, so.
Yeah. People, places, and things.
There you go. Certain people, you're right.
Yeah, so.
All right, well, it's good to talk to you today.
Dan, there are many drugs out there, addictive drugs that young kids get into. And, do you believe that there is a choice for certain people who live in the city, who live in the suburbs, in the, not the country, but rural areas?
A choice as in?
Of what drug is more popular in that area.
Okay. I think the way it seems now is now that fentanyl is in almost, it's in the cocaine, it's in the heroin, that the opiate high is what a lot of people are getting drawn to. Whether it starts off at lower level, from Percocet, Vicodin, a lot of the, growing up, it was drinking, partying, but there was also opiates. And I think it's just going to increase with the fentanyl being brought in, and it doesn't necessarily matter what area you're in. I've met a lot of people from all over the state of Pennsylvania, different states, that they do have their different substances that they use, but the most of the people that I know seems to be the opiate and alcohol. Those two are the most prevalent.
Thank you for that, sir. Captain, since you're sitting over here and you're a former drug agent, supervisor of my drug task force, sir, can you explain the difference between the carfentanil and the fentanyl, sir?
The carfentanil is about 1,000 times stronger than the fentanyl. Fentanyl is a synthetic drug, most of which is developed and shipped from China to the U.S. There's no legitimate medical use for it. The ones that have been used here for medical purposes is very different than the one that's manufactured and brought in. You don't know what it's being made of. You don't know the quantity and the quality of it. Heroin today is about 95% pure compared to the 70s. On top of that, you mix in the fentanyl. That's why you have so many overdose deaths. The deaths are multiplying yearly. They're almost doubling each year since 2016. In this county, our city has had to date about 245 overdoses within the city. A large portion of those individuals don't live in the city. As Officer Kreiser said, it's considered an urban problem, but most of the victims don't live in those urban areas. That's just where the supply is. That's where everyone comes from. Now, unfortunately, the drugs are being cut with so many different things. Remember, when you get a prescription, there's actually someone who's guaranteeing what is in there. When you're buying a drug off the street, you're hoping that you're getting what you asked for, but you have no clue what's in it. And unfortunately, that's what's killing a lot of people.
Yes,
Thank you. Kathy, with your current program, I understand that you're teaming with other programs too.
Yes.
To combat the opioid crisis. Do you think that we're making any sort of progress in doing so?
I think that we are making progress. I mean, some days it does seem frustrating, as I said earlier, because it feels like we're not getting anywhere, but I think that we are with the younger generation, you know, starting to make those changes and people are more educated. I think the big thing that we can do, I also work a second job in healthcare. I work on the traumatic brain injury unit at a large hospital, and I'm constantly saying that as far as in healthcare, we need to do better. We need to educate more. We've had wonderful experiences with police officers. We've had very negative experiences with police officers as our family has gone through this process, and the same with healthcare. I think that we're in a position where we can really educate people and change people's views, even just by changing our verbiage to maybe end the stigma and the judgment that is cast upon families that are suffering from substance use disorder, and encourage more people to come for help. Because I know, as Wendy said too, I hid for 2 years. I delayed getting my kids help for 2 years. I spent 2 years trying to fix my kids, and you can't fix them. You know, I've had my kids arrested and put in jail hoping that they would sober up. When they finally went to help on their own is when they finally, you know, did better. But I was just so terrified of the shame and judgment that society casts on us. So I think that we could all do better there.
Thank you for that. Gina, can you add or take away something from what Kathy said?
I think just when we were talking about in the schools, I am just so surprised at how young the kids today are dabbling in juuling and nicotine. I mean, I am so blown away by that. And so, you know, we know, again, that that's one of the biggest risk factors is, you know, with the adolescent brain, and it doesn't develop, you know, for females 23 and males 25. And so, you know, with this early onset, and this is my own little focus group, I guess, with my kids, but I just see, I think about, you know, the 30, the 26, and the 22-year-old, and I didn't see the magnitude of even juuling or vaping or smoking back then. But now with our 17 and our 19-year-olds, I see such significant use. And also, too, with the marijuana. Everywhere we go and speak, every single time we have a parent that'll say, how can I battle this conversation with marijuana and my teen? What can I say? And a lot of the parents, it'll be like, well, it's just a stage that they're going through, or, I did weed when I was in college. But again, the drugs of the yesteryears are very, very different than the drugs are today. Yes. And so just, talking to the parents, getting them to fully understand, what's going on again, amongst the kids in the schools. Peer dealers, we even talk about peer dealers, and making sure that they understand what that looks like, and the magnitude of what occurs even in sports teams, and because like the officer had mentioned, it's across the board now. There's no specific class or type anymore with the kids.
Thank you.
If I can just add in one more thing I should have mentioned, I did not. My children were also involved in sports, so all three of my boys played football. My daughter was a cheerleader and a volleyball player. She was actually the star volleyball player for our district, and half of her volleyball team is dead from an overdose.
So how long ago was that, Fitzky, that we had the overdose back here?
July, August.
Yeah, we had an overdose back here, and it appeared that he had been laying back here for quite a long time. We ended up, I believe we Narcaned him twice, and he didn't respond after the first dose. After the second dose, it took a while. EMS got here and bagged him and everything, and then he woke up. So thankfully somebody, there's a cap right there. Somebody spotted him back here because it's kind of secluded. Right there you see a needle. But you see right here that's like the cap that goes on the end of the syringe, the plunger.
I mean, I see a kid's toy, so I'm thinking kids would also be back here.
Mm-hmm. Yeah, the kids play back here during the summertime.
Yeah, these houses, these are all apartments here. They've got people in them.
Dan, you had mentioned earlier that the opioid process is a step process, that you usually start off with something not too bad, and then you sort of graduate into other things. Can you explain the process to us?
For me, the process was that way. When I got into the prescription pain medication, I couldn't afford it, and the cheaper version is heroin. So that's what drew me to that. With that, there's a lot of things that for me that we have all touched on stigma and underlying issues of addiction. And for me, I didn't know how to process feelings without going to a drug. So what I would do is when I finally felt like I needed to speak up about it, I felt like I couldn't. In my household, we were told what happens in the house stays in the house. So it was kind of that mentality that I need to be tough, I need to know everything, and I can't tell people I'm struggling, even though I'm really struggling. And I just masked it with drugs all the time. And for me, I just dug deeper and deeper into masking that pain that grew larger and larger.
Thank you for that. Officer Kreiser, you're a champion of the people. How does that make you feel when you administer the Narcan to bring someone back?
I think that, and I don't know if a lot of people know this, but we don't have to use it. Some people aren't comfortable using it. I don't have a problem using it, and if I can give somebody a chance to turn out like him, it's a good thing. If you can save one person, I have one gentleman that's probably I think he's in his 40s, that every time he sees me now he thanks me. And I've Narcaned, I don't know the numbers, but it's probably over 30, 40, I don't know. But one person, every time, the first time he came up to me, he said, "Don't you remember me?" And I was like, "I don't." And then he told me, I was like, "Oh, okay." So every time he sees me, he says thank you. So if you can make a difference for one person, or even give somebody a chance to start, seeking recovery, I think it's worth it. Everybody has family. It's a daughter, a son. It's somebody to somebody. So that's how I look at it.
as an officer, police officer, the public don't understand the toll it takes on a police officer when they come across a scene and it's overdose, and they administer Narcan and it's late. Harrisburg City has a lot of younger officers, and it really takes their toll because a lot of our calls are for overdoses, and it weighs heavy on the officers' minds and stuff when they feel that they can't do any good by the people and for the people. So thank you for everything that you do, Officer Kreiser.
Thank you.
Dan, I'm proud of you. I think that you're going to be doing things. You're going to be going places, and younger people are going to be reaching out to you. You're a role model to them. What advice can you give our younger generation?
I guess the biggest piece of advice is, if you're struggling with how you feel, and just to talk about it, to talk to someone, even if it's not a family member or a friend, reach out to someone. The more advice you can have on a situation, the better chance you have at tackling it with a positive solution. That's probably it.
Okay. Kathy, you suffered a horrific loss. What advice can you give any parent?
Don't give up hope. That's one thing I never did. When my son passed away years ago, because unfortunately any parent that has dealt with the issue of having a child with opioid use disorder, there's grief before this even happens. We have a lot of anticipatory grief going on. So we spend our days, most moms of children with opioid use disorder have severe anxiety or post-traumatic stress disorder as a result. We spend our days in fear, waiting for that phone call, waiting, what's going to happen next. So I decided long ago that no matter what happened with my kids, I would end every conversation with "Be safe, I love you." And when I had spoken with my son the last time, I have that to hold on to. So, but just don't ever give up hope. Although I did lose one, I have 3 that are in recovery and flourishing, so.
Thank you. Gina, can you add to that?
Yeah, I just think for families not to be alone on this journey. That's probably my biggest message from a family perspective is reach out. If it's eye care or if it's Drug-Free Workplace PA or the RAISE Project, or, we are very blessed in PA to just have so many organizations that truly want to help and do care, and you have to put that stigma aside. I often say I wish I had one of me 4 years ago. So that's why I work every single day. Kathy and I both have that mission, so we don't want families, to ever be alone. But then also, too, I often say I wish that families would spend as much time as they do shopping for colleges as they would on this topic, and also, too, if in fact the child is suffering at all with any mental health, to address it. So just making sure that, that is just as important, and that the families fully understand addiction and the signs and symptoms.
Yeah.
Thank you for that.
Support groups are very important.
Oh, yes.
I probably would not be able to be sitting here right now. I feel blessed that I was involved with so many support groups. It was a place I didn't want to have to belong. And then, we call it the club that nobody wants to belong to is what I'm now in. So,
but they're critical.
But when this happened, I had so many people reach out to me that have been here before and, walked me through it and just carried me when I couldn't.
Thank you for that, Kathy. I would like to thank our panel, Gina, Kathy, Dan, Officer Kreiser. and the audience for the input that you had today. Hopefully, you know, we helped someone with their child. We helped somebody to understand what the opioid crisis here is. And remember that the opioid crisis does not discriminate against anybody. It touches every last one of us, and this is a human toll. It is a national crisis that we're dealing with right now. And we thank you for your time.